Welcome to the session on reproductive rights as a part of BGSC 001 course. Let us first review some of the human rights and the health rights which we have covered in the previous sessions. As we know that gender equality is the basis, or you can say heart of the human rights and the United Nations value. United Nations Charter in 1945 emphasized the equal rights of men and women and protecting and promoting women's health or women's human right is the responsibility of the respective state of every country. WHO Constitution in 1946 emphasized that the highest attainable standard health is a fundamental right of every human being. If you remember the definition of the health is a state of complete physical, mental, social and spiritual well-being, not merely an absence of disease or infirmity. And it's a fundamental right of every human being, irrespective of the age, sex, creed. Even the Constitution of India emphasized that, and the Article 21 of the Constitution guarantees a right to life and the personal liberty. Right to life includes the right to health also. It's basically integrated in right to life only in the Indian Constitution. As you know that the highest attainable standard of health is one of the fundamental rights of every human being. Already we have discussed, without discrimination of race, religion, political place, economic status or the social conditions. Everyone, irrespective rich or poor, irrespective of men and women, living in whichever conditions and during the life course at every stage, has the right for the health. Violation of human rights of the people, especially of the vulnerable group. If you see here, women, old people, women or the people with HIV, sex worker, people who take drugs, LGBT. Not only their rights are being violated, but they are risk of increased exposure to human right abuses too. Right to health is that everyone should have access to health services whenever they need, wherever they need, and without any suffering or financial hardship. This means they should be provided with health services whenever they need, according to their need. It is day, night, winter, summer, anytime they are living in the tribal areas, rural areas, slum areas. There should not be any distinction, because if they will not get the health services in time due to various reasons, due to communication, due to transport, due to financial hardship, then there is a violation of their rights. Right to health is also means that everyone should be entitled for the basic health care. Health and body should be healthy of everyone, and they should have access even to sexual and reproductive services, information from all the institutions at all the levels. If they are not being provided this, there is a violation and discrimination. If you see, at many places, the women face hardships to attain these services when they need it. and therefore there is a violation and discrimination of services provided to the women. Everyone has right to privacy and nobody should be subjected to medical experimentation, treatment without informed consent. That means everyone, irrespective of, already I have told you, race, creed, social structure, they have the right for the privacy and the treatment with respect and dignity. And no experimentation should be done even with the treatment without the informed consent. Informed consent does not mean just a paper, get the signature and get the consent. Informed consent means they should be informed in detail about the treatment, the advantages, side effects, and what is the cost, if anything is to be there, and what can be the future consequences and the benefits. If you see the International Conference of Population and Development at Cairo in 1994, it has come out with the paradigm of human rights, sexual and reproductive health as a right, and it addresses the human reproductive and sexual health is one of the most important component of this Cairo conference. And if you remember, we have discussed there was a program of action which was adopted by most of the countries. For this, there was a discourse about that program of action will include specifically reproductive and sexual health services and activities for the women, and there will be an empowerment of the women, evolving discourses about the you can say human rights and the health, and it was taken into consideration that sexual and reproductive right is one of the most important component because there is a life course interventions has to be adopted. Right-based approach in the health. What is it? If you remember, we have already discussed this was even a part of Millennium Development Goal and Sustainable Development Goal, which emphasize that by 2030 agenda of Sustainable Development Goal, women and child health, and to achieve the universal health coverage. This is one of the most important aspect which has to be taken care of in all the policies and programs of all the countries. Reproductive rights. If we see, reproductive rights are the subset of the human rights in the United Nations, which we have already discussed in detail, but again we are emphasizing. If you see specifically, they have not emphasized on the reproductive rights, but they are part of the right to life or human rights. First of all, the first country which adopted the sexual and reproductive health rights of the men and women was the Treha. That is, the parents have the basic human rights to determine how many children they will have and the spacing of the children. They emphasized that it is the right of the parents, right of the women, right of the father and mother to decide, not the family has to decide. If we see in our country, basically it is a family issue. The family decide about all these issues. Before 1975-85, even the United Nations has not given the importance to sexual and reproductive health or the women's health. But the decade that came in 1975-85, the decade of women, which forced not only the United Nations but other countries also to think about women's right, sexual and reproductive health and the women's health. From that, the reproductive health rights are the legal rights that emphasize the freedom related to reproduction and the reproductive health. That was the basic or the central point of the women's health or the reproductive health. Sexual and reproductive health are influenced by cultural, social norms, socio-cultural factors, and various other laws and regulations. If you remember the social context of the health, what we have learned is there are various cultural factors. Like India is a vast country, every state, every community have their own socio-cultural factors which actually impact the sexual and reproductive rights or the sexual and reproductive health of the women. Reproductive rights are the basic rights of the couples and the individuals to decide when they want to have a child, about the spacing, timing of having a child, and to have information and the services of quality, highest standard services so that the sexual and reproductive health is taken care of. Some of the things, if you see, do women have right to take decision about their health? Do women have the right to decide how many children they will have? Do women have access to safe birth control methods? Do women have the right for the safe abortion? And many other questions related to this. If you see, the answer mainly is no. When the women do not have the rights or decide about themselves, then what about their reproductive and sexual health if they are not allowed to take the decision what type of health or what they want in their own life, because they are not allowed to take decision in this patriarchal society. Women's and the sexuality is a crucial aspect of reproductive freedom. That you should remember. Unless women have the rights, women's rights are being taken care of. Women's rights are emphasized not only by the government through laws or regulation, but also in the families and the community. Till then, women will not have the reproductive freedom. Women, actually, if you see, in the patriarchal family, who controls the women's health or the body of a woman? It's the husband, who have all the rights to control the women wishes, body and decisions when, where she will go to take care. In this situation, if women do not have any control over their body, when to get married, when to have children, when to have sex, even the government policies, if you see, the government forcing women to undergo the sterilization. The statistics show maximum in the family welfare, adoption of the family welfare measures, the women undergo sterilization due to various reasons. Many a times, women even do not want that their husband should undergo the sterilization due to their own concepts. So you can see it's not only the family, even the policies, if you see, they target the women because it's easy for the target group to convince them based on their social cultural environment. The personal preferences of the women for safe and active role in decision making. Are they allowed to take decisions about their sexual and reproductive health? In the patriarchal family, if we say conclude like that, if the husband has control over their needs, if family have control over the decisions, then what about the preferences of a woman? How she can play an active role in decision making? This is the one aspect which has to be taken care of. Women's sexual and reproductive health is related to multiple human rights. If you see here, these are some of the rights which includes the sexual and reproductive rights also of a woman: right to life, right to health, right to privacy, right to education, and they are integrated in this. Even when the judgments are passed by the court, they actually interpret all the rights and see that the women get the justice. There are the two commissions which have taken a stand for the women's reproductive and the sexual health, that they say the state should protect the health rights of a woman. State had the responsibility to provide the sexual and reproductive health services to the women in the respective country. Even in India, we have three lists: union list, concurrent list, and the state list. Mainly, health is an you can say a responsibility of the state to provide the public health services and all the maternal and child health services. Union government provides the guidelines, and the concurrent list, some of the responsibilities are overlapping in the concurrent list. There are obligations. If you see, despite these legislations, administrators, you can say guidelines, still there is a violation of women's sexual and reproductive health rights, which you must have seen even in your daily life, in the various communities, in your home, in your community, or in the workplace where you are working. So the question arises here, when there are so many rule, regulation, guidelines, charters are being passed out, united conferences are being organized, various plans and policies are there, then why these are not being implemented? Again, if you see in the greater scenario, it depends upon the socio-cultural factors, political will, financial constraints. What is the value of women in the society? It actually has an impact on the health rights of the women and sexual and reproductive rights of the women. There are so many incidences where women hardly get the care, delay in the care, forced sterilization, unsafe abortion services, teenage pregnancy and services to the teenagers. In the old age, after menopause, what are the services provided to the women? Services to the LGBT. So they are very vulnerable. If you see, many studies are being done in the hospitals where women are taken as the participant in the research because they are vulnerable population. People convince them very easily. So women's right, women's health, even in the labor room if you go, how the women are being treated, what information is provided to the women for the services. So these are some of the issues which still, with so many rights of the women, still they have to be taken care of. Again, there is violation of the reproductive and the sexual health rights of the women, and it is very important that they have to be taken care of not only by the health sector but also by the various societies. The old approach of the maternal and child health care or you can say the policies before ICPD was mainly on the population control. But at the ICPD, it was decided that human rights or sexual and reproductive rights or the women health is not only related to the population control, but women health and well-being is an important aspect which has to be taken care of. So the new structure which focused on program of action was on empowerment of women, personal autonomy of the women, sexual and reproductive health within their social, economic and the political context. So every country had their own reproductive and child health program, plans and the policies. Even in India, in 1997, we had first reproductive and child health program, and then it was revised as reproductive and child health program phase 2, and now it is known as reproductive, maternal, neonatal, child and adolescence health. The approach recognized that women health is of importance. Sexual and reproductive health in particular is determined not only by providing health services but also by the status of women in the society. So you can see here, not only providing services is enough, but it is also important to empower the women and to increase the status of women in the society. Then only the health services, sexual and reproductive health of the women will be taken care of. ICPD program of action emphasized on human rights of the women. Rights to personal reproductive autonomy, greater equality as a primary principle of providing reproductive and sexual health and the population program. It's very important that women has to come forward and to decide and to take action that what I need, what is good for me. Yes, it may take time, but with so much of awareness, a time slowly is changing where women are coming forward, not alone but due to they have a legal support and the support of various women organizations. Women right in Indian context, already some of the things we have discussed. If you see, they had access to make reproductive choices and there is a control over reproductive functions. Then access to education about contraceptives, sexually transmitted diseases, then protect from gender-based practices, especially various procedures which are being carried out only on the women. In India, reproductive rights are actually, you can say it's a part of the constitution. Already I have told you, right of the life and right to health. But if you see, in reality, they are controlled by the family or the you can say the member who is the decision making in the family, maybe the husband, mother-in-law or the father-in-law, whosoever is there. That is the condition in India. Many of the health institutions, even if you must have gone with someone or you must have visited the hospitals, they want the consent of their husband or someone who will take the decision on behalf of the women if they have to undergo abortion or DNC or any other procedure. It's actually the women's right and the privacy and the freedom is not taken into consideration because women, they feel, has no right even to sign for their own health or give the consent for their own health. So this is the condition. And there was an a survey for the G20 countries based on the women's right, and there the India ranked the last. And in another survey it was found that empowerment of the women through education, politics, and the ranked India second worst country in relation to the women status and of the women in the country. So Constitution of India gives a right to health, right to sexual and reproductive health, which is ingrained in the right to life act in the Constitution of India. And Supreme Court judgments, when they have to give, they always see that women's health is not being compromised and women rights are not being violated. So they always integrate in the right to life when they give the judgments. Then there are several provisions under the directive principles of the state policy in the Constitution under Article 47, which already I have told you in the beginning that it is the responsibility of the state to take care of the health of the women, especially to improve the public health services is to be provided. Like you see, every state have their public health infrastructure, starting from the sub-center, primary health center, community health center, the district hospital, and in the urban center they had the health centers and the tertiary hospitals. And it is the function of the state to see that all the services, especially the MCH, maternal and child health services in all the hospitals, are given the priority. And the maternal indicators, which we have studied in our previous sessions, have a great impact on the health of the state. Then the women have, if you see, they have many laws are there. By 1990s, even the national health programs, they were based on family planning. But in 1990, Department of Women and Child Welfare was established, and the Women and Child Commission was established in India, which forced the government to make various legislations, various guidelines to take care of women who are raped, who undergo domestic violence, and many other incidences like that. You must be reading in news, although the justice is little late. But few women gets the justice. But many of the cases are not being reported. If they are reported also, they are taken back. Again, if you see, because women live in a society, they live in a family, there is a pressure from the family to withdraw the cases. If you see, in this, a case book was published where various high court judgments, how the judgments were taken, how they were implemented, and what were the constraints, why they were not able to implement the decisions are highlighted. If you are interested, I have given some of the links at the end. You can go through those links and read in detail the case book, which highlights various case studies related to women's health, women rights, sexual and reproductive health. Then there was a case where in Bihar, a sterilization camp was organized, but there were many complications were there to the women because guidelines were not followed. There were complications in hygienic conditions where sterilizations were undergone, and complaint was filed by the NGOs and the women group. The district health society, when they scrutinized, they found the procedures are not being followed. But the NGO which has conducted this camp wanted to consume some of the medicines which were going to expire. What they did, they just took one school and they completed all the procedures there. But there was a women group who came forward and fought for the women's right. They brought into the notice previous judgments where it was shown that guidelines needs to be followed when all these procedures are to be done. There has to be a qualified doctors and the team which they can do. There has to be a proper infrastructure, equipment. All the information needs to be given to the women before they undergo sterilization. All the advantages and disadvantages and the complications. After this, a judgment was passed that in future, all the guidelines which are followed which are given by the union government as a manual has to be followed. Because you cannot take women on granted that you can do anything with the women. Women have their own right. Women have right to privacy. Women have sexual and reproductive health rights. And they have the right to know the information. They have the right to know what services are being provided. And they are guided by the various rules and regulations. So, in just we can say, women's right, reproductive and sexual health is one of the very important component of the maternal and child health care. Even the Constitution of India integrated into the right to life and right to health as part of women's reproductive and sexual health. There are certain cases, if you are interested to go through, these are the links you can see here. Links are being provided. You can go through various documents and the various cases which will be helpful for you. In nutshell, we can say women have the right to live like any other normal human being. They have their right to life, right to health, right to privacy without any discrimination, without any violence. They are human beings. So treat them as a human being. Thank you so much.